Taking a precise impression of the patient's clinical situation is necessary for accurately detailed and dimensionally stable models. The industry offers the widest variety of materials for this. An appropriate impression material can be chosen according to the patient's result and the model's purpose. The most common indication for alginate impressions are diagnostic and planning models. These models are intended to duplicate all intraoral structures in accurate detail: the teeth, all ligaments, the palate or tongue region, the entire gingivo-buccal fold and the gingiva. The impression material for diagnostic and planning models is alginate. It has sufficient detail accuracy for these requirements. The reactive portion of the powder consists of water-soluble salts of alginic acid, which is obtained from marine algae. Alginate comes in various forms of administration. On one hand, a processing-friendly, ready-made version portioned into tightly sealed individual bags for fast and safe mixing. On the other, alginate is offered in the economical storage jar. Always shake well before opening, because the powder's individual ingredients are easily segregated due to their different weights. The aforementioned dosage must be followed exactly so that the material properties are not altered. The container must be resealed immediately, because the admission of atmospheric humidity influences the powder's properties. For taking optimal impressions, the amount of water must also be measured precisely. The mixing water's temperature influences the setting time. Colder water lengthens the processing and setting time, while warmer water shortens it. To prevent agglutination, the measured water amount is firstly added to the mixing cup as close to room temperature as possible. Dosing bags are simply cut open and all their contents poured into the water. The alginate is now spread expansively along the cup wall and air pockets squeezed out. The mixing time should also correspond to the manufacturer's specifications. In this case, it is 45 seconds with manual mixing. Machine mixing is much faster and always produces equally good results regardless of the individual mixing technique. The finished mixture is very homogeneous and in vacuum devices free of air bubbles. The consistency is much softer than with manual mixing. A tip: vertical sites, greatly expanded approximal spaces or pontics must be blocked out with wax to prevent severe deformation or the alginate tearing off when the impression is removed. Only use stable, connection-safe and unperforated metal trays with retention ridges, for example, rimlock trays. Because of alginate's low tearing strength, perforations of the tray or bonded-in retention strips are not sufficient. To determine tray sizes, the extension of the dental arch is measured with a pair of dividers and the corresponding tray size then chosen. A layering thickness of at least 3 mm must be guaranteed to compensate for alginate's lack of elastic recovery and elasticity. To prevent extrusion and facilitate correct positioning, stops are inserted into the impression tray. They naturally guarantee the required distance. All sites where the post-palatal seal and palatal stops are to be applied are greased with a silicone primer. Post-palatal sealing of the maxillary elastic tray with a putty causes condensation of the impression material. The tray cannot be extruded, which means an even layer cover of the material is produced and the alginate is prevented from escaping into the pharyngeal space. Projecting edges restricting the actual impression space or obstructing the patient in impression taking can be removed with a scalpel or sharp knife. This is best done when the material has been cured as fully as possible. The occlusal stops can now be removed. For the alginate to hold better, the entire inner tray area and outer edge are greased. For hygienic reasons, the supplied brush and original bottle are not used to do this. Instead, some adhesive is poured into a dampened glass. With the furthest distal teeth, the alginate is mostly not supported by the tray. Often, therefore, only an inadequate impression is taken of them, or they're left out completely. In these cases, an individual tray can be made by extending the tray with light hardening plastic from a stock tray. After the try-in, the extension is cured in a halogen light device. A standardized procedure is required to achieve consistently good results when taking alginate impressions. The patient is put in a comfortable lying position and the headrest adjusted so that the head is not overstretched and the swallowing reflex thus disabled. A brief try-in is required for molding the post-palatal seal. For this, the tray is lowered until the bonded-in stops hit the row of teeth. The teeth are greased with alginate beforehand to make it possible to take bubble-free impressions of the teeth rows. That prevents an air cushion in the fissure region that could cause bubble formation. The tray is also filled with a bubble-free homogeneous alginate impression compound. But the fingers must not be moistened with water in this process because that would cause the powder-water mixture to be changed. When taking impressions in the maxilla, the tray should firstly be pressed down in the posterior region and then in the anterior tooth region so that no material can get into the pharyngeal space. If the correct position of the tray is found, it is safely fixed during the setting time without pressure and using 3 fingers. When an impression of the mandible is taken, the patient should close the mouth as far as possible after the tray has been inserted, because if the mouth is open